Hello, I'm Dr. Robert Russo, Executive Director of the Connecticut State Medical Society. Welcome to On Call with Connecticut Physicians, the Medical Society's podcast initiative.
I'm looking for an overall assessment or view from you, Dr. Russo, or any of the other folks there, about how you think that the last year, the pretty much 12 months exactly since this pandemic arrived in Connecticut, has changed, improved, hurt, or otherwise sort of evolved the relationship between patients and doctors, that sort of very personal relationship. Is there a sort of a view you have of that, how that dynamic has changed?
I can speak to that as somebody who's practicing, and I think that's a great question, Dan. It really has had an impact, and I hadn't thought about it till you raised the question. But I think there is a profound sense of community when patients come into my exam room. And the first thing we talk about right now is, have you been vaccinated? And how positive people feel and how hopeful they feel once they've received the vaccine, and how anxious they are if they haven't. So I'm an ophthalmologist. That's just a peripheral part of what I do with patients, but it's become an exceedingly important and actually rewarding part because I can share with my patients that I have been vaccinated and my experience with it. So great question. I think it's very positive moving forward. And again, it reinforces how important it is to have vaccines in the medical home.
So Dan, as an emergency physician, there's so many people worried about COVID, and rightfully so. But one of the things that happened this year, in sort of everyone pausing their lives, seems that they did delay care. There were studies that came out that said the deaths from strokes and heart attacks not seeking care went up. The volume in the emergency department still around the state is down 20 to 25%. And so it seems that people have stopped some of their interactions, which are concerning. And I don't have a reason necessarily why, other than people are not maybe going out as much, but they've just paused all aspects of their lives. So whether it's going to school, going to dinner, or going to the doctor.
And do you see that recovering to the full extent that it was? Routine care, that is?
Yeah, in the emergency, we have not come back up at all. As I said, our data from February, at least in the 4 emergency departments where I work, is still down 25%. And I think there's threefold, and some of it's good, as maybe we've adapted, and some of it is not good. So I think telehealth and access to other ways to get into healthcare has probably removed some of the emergency department visits, and that's fine. If people are having access again to high quality care, then that's good. I think our hygiene practices have reduced some disease. I don't know if that's long lasting. So washing your hands, using Purell when you go in and out of stores, wearing masks, not only does that prevent COVID, but that prevents a lot of other communicable diseases. And so I think that is wait to see. But people pausing their lives, every day I work a shift in the emergency department, I would see an adolescent, a youth, from a sports injury. Well, not as many of those are happening. So our just less activity, I think, has also reduced some of the volume. But the ones I'm most concerned about are the people with chest pain that say, well, I'm not vaccinated, I'm not going to the emergency department. And then they didn't get their chest pain evaluated when there was a time to intervene before a heart attack. And I still think that trepidation and hesitancy is out there where people are just not seeking care and when they normally would have. some old statistics for chest pain in the emergency department, only 15% turned out to be cardiac, 85% was non-cardiac, but sometimes it's very subtle. And if people aren't presenting with those subtle findings, oftentimes you miss getting that diagnosis early. So we still want to encourage people, to seek out healthcare, because the prudent layperson is very important. And we don't expect everyone to do their self-diagnosis at home with Dr. Google and Dr. WebMD. So, I still think there's value of that interaction with the physician.
Yeah, I also think that it's important. We usually move forward in the relationship between the patient and the physicians over time. I think COVID kind of bumped us so that we flew forward. Not only did the patients learn, but so did the physicians about telemedicine and other ways of doing things. Coming on the horizon is the HIE, the health information exchanges that are out there. We can now database a lot through those HIEs and be able to anticipate. UConn with Rob Hazeltine is doing research on predicting suicide. And he's doing that with artificial intelligence and gathering data. This is all new to the private practicing level of patient care. And I think you're going to see now that the doctors will move much quicker forward with much better reliable data about what's going on. I think COVID's done that. The other thing it's done that the other two physicians have already mentioned, it did bring the patients closer, I think, to their doctors. If you watch some of the studies, they would say what physicians are the most trusted group of any profession. And they would always say, well, that's dropping, until you got into the weeds about that survey. And they would say, well, not my doctor. My doctor I trust. Right. The other doctors I might not trust. But the reality of it is, when you're trying to make decisions about COVID and vaccinations and other things like that, I think that bond is coming tighter because they do trust their own physician and how it goes through. So right. With all the newer AI, HIEs, I hate to do it all by letters, but telemedicine and the things that Greg's recognized in the emergency room, all these things are rapidly changing.
So they see you less, but they trust you more.
Well, they don't, when you say see us less, they actually interface with us probably a little bit more because of telemedicine. I mean, a lot of pediatricians always gave out their cell phones so you could text them and ask the in quotes, I don't want to say incidental, but the questions moms always had about the first baby, and they were able to do it that way. Now that's kind of reached even further, where either these Zoom calls or web or whatever we're using, I think that's going to have a major effect with people being able to interface. The governor's executive order finally approved the fact that that's something that physicians should be paid for doing, instead of just avoiding that sort of phone conversation, telling patients to come to the office. Thank you all for listening to our conversation on the Connecticut State Medical Society podcast. Please use the contact information provided here for questions and more information related to the legislative activities in the 2021 session. You can listen to other episodes of On Call with Connecticut Physicians at the Connecticut State Medical Society's website, csms.org. Be sure to engage with CSMS by following us on Facebook, Twitter, and LinkedIn. We look forward to seeing you here next time.